Nephrostomy. Introduction. The kidneys filter the blood to remove waste products. Select true or false. Correct. Nephrostomy is done to prevent a kidney from being damaged due to urine buildup. Select true or false. Correct. A nephrostomy will drain urine from a blocked kidney or blocked ureter into a bag outside the body. After a nephrostomy, will you be unable to urinate normally? Select yes or no. Correct. You may find that you still pass some urine through the bladder and urethra after a nephrostomy in one or both kidneys. Placing the tube may hurt a little for a short amount of time. Select true or false. Correct. Tell your healthcare provider if you feel pain or anxiety. You may receive painkillers. You should get up and move shortly after surgery to decrease the risk of blood clots. Select true or false. Correct. Blood clots in the legs can happen due to inactivity during and after the surgery. Getting out of bed shortly after surgery may help decrease the risk of blood clots. Greg has a nephrostomy tube. He has a fever and it is painful to pass urine. His urine also looks cloudy. Should Greg contact his healthcare provider? Select yes or no. Correct. Greg should contact his healthcare provider immediately. Only his healthcare provider can tell what is causing his symptoms. Thank you for using Explain.